The newsday continues here on One News Now. I'm Riza Diaz. The Quezon City LGU is providing free COVID-19 testing for its residents who lined up at a community pantry in Barangay Holy Spirit on Friday. Let's get the latest on this testing efforts with the chief of the city's Epidemiology and Disease Surveillance Unit, Dr. Rolando Cruz. Doc, good afternoon.
Good afternoon, Risa, and to your listeners.
Doc, how many testing slots have we opened for these residents?
Well, actually, anyone who actually wanted to get tested, especially those with symptoms, we can actually accommodate them. We have we have 17 community-based testing sites all over the city, so they can be accommodated there.
Doc, just to clarify, is this testing effort available only for those who lined up for the community pantry in Barangay Holy Spirit, or can you also accommodate those who lined up for other community pantries in the city?
There's anyone in QC citizens who are experiencing COVID-19 symptoms or a close contacts of a COVID case. No, we offer this free testing to anyone who have the same situation. So not only those that were exposed during the last day's event, but for anyone, actually, anyone who wanted to get swabbed because they have symptoms or they have been in close contact with the COVID case.
Clear. Doc, the LGU announced additional guidelines for these community pantries. What other measures are you looking to implement?
So we have learned our lessons. Crowding is really our enemy. Even if you have a good intention of providing free food or goods to our people, we may have to make sure that minimum health standards are followed. So we've learned our lesson. I think we need to move forward. The guidance has already been released by the local government of Quezon City. This must be followed through. Otherwise, transmission will occur in these community pantries.
Dr. Cruz, can you give us an update on the COVID-19 situation in the city? Are we seeing an impact from the emergence of community pantries as to the numbers?
That's too early to say. For example, in the other day's event, there was around 5,000 crowd or 3,000 to 5,000 crowds in the area. You will see the impact of this at least a minimum of 5 to 7 days. No? So we'll see if there are a lot of or increase of number of cases in Holy Spirit. So we'll know that by next week or middle of next week.
Doc, how about the vaccination efforts? How is it going? Has online registration resumed?
Yes. The online, they will get a notification for those who have registered online, and then there are also special registration ongoing in certain barangays, especially for those who have scheduled second dose, for their scheduled second dose. So as soon as we have received more vaccines, we will have offer more slots for registration.
How far are we along, Doc, when it comes to inoculating health workers and senior citizens, also with, of course, our people or persons with comorbidities?
We're almost done with our health workers. We are now concentrating on the senior citizen and those with comorbidities. No? So we still have a long way on those two categories.
Finally, Doc, what's your assessment on household transmissions in Quezon City? Is it still rampant? And what happens when only a few members of a family has been vaccinated? What risk are we seeing?
So the vaccination is not a guarantee that we will not have a COVID. No, we have yet to prove that in our existing vaccine right now. So it is, but what it guarantees is not to have you a severe COVID disease. No, that's one thing for sure. So So if a family gets a COVID case, it is really have a great chance that everyone can still be infected if still majority of the members of the family are already vaccinated. But the good thing is we will be avoiding deaths, no, and serious illness among those who were vaccinated.
Dr. Cruz, thank you for joining us. That's Dr. Orlando Cruz of the Quezon City's Epidemiology and Disease Surveillance Unit. Now, here are other stories we're keeping our eyes on. Personnel from the Coast Guard and Bureau of Fisheries and Aquatic Resources conducted a joint maritime exercise in the West Philippine Sea. 8 ships were sent to Bajo de Masinloc and Pag-asa Island on April 24, including groups of lawyers, medical workers, and IT technicians, among others. PGC spokesperson Commodore Armando Balilo says their aim is to optimize Coast Guard's assets through a harmonized command. Baguio City Mayor Benjamin Magalong blocks 2 proposals passed by the Baguio City Council allowing operations of both traditional and electronic bingo in the city. RCC Global Entertainment requested to operate the games as authorized by PAGCOR. And oral arguments against the Anti-Terrorism Act of 2020 will resume on April 27, Tuesday, via video conferencing. Solicitor General Jose Carida is expected to continue delivering the government's defense on the highly debated law. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. Over 1 billion COVID-19 vaccine jabs have been administered globally as countries continue to ramp up their vaccination efforts. With the pandemic still showing no sign of slowing down, governments around the world are continuing to place their hopes in vaccines. News agencies AFP reports that at least 1 billion vaccine doses have been administered in 207 countries and territories. The number has doubled in less than a month worldwide. Now, amid the increasing demand for COVID-19 vaccines, low-income countries are finding it more difficult to gain access due to economic inequities. So what can these countries do to solve this problem? WHO Assistant Director General Marianne Jala Simo tells us in this interview.
Mariangela, my first question to you is, this lack of access to medicines, treatments, to vaccines around the world, how is that impacting our fight against COVID-19?
I think this is a very good question because we are talking about something that's very actionable, which is equity in health care. Right? This is a no discussion, and this pandemic just made what was bad worse. And we are seeing huge inequities in access to health care in many, many countries, within countries and across the world. And we're seeing that problems that were chronic in some countries, like the oxygen provision to patients with pneumonia, for example, have become much more acute right now because of the issues with the number of cases increasing so much. We also see that we know more than we knew 1 year ago on clinical care, and we see that medication that are not under patent or anything, that are actually quite cheap, may not be available in some countries, and they make a difference when you have a severe case of COVID-19. So there's a lot that can be done, because we always say that equity in healthcare, it's above all, it's not only preventable, but it's also actionable.
Mariangela, I wanted to ask you, if a country can afford to vaccinate their entire population, why should they not do that? What exactly is WHO and agencies like WHO, what are we asking these countries to do exactly?
It's not about getting to the moral high ground, but it's something that should touch every human heart, because this year we have supply problems, 2021. We don't have enough vaccines to vaccinate everyone in the world. And what WHO and other partners, international partners, are advocating and pushing very hard is that to end the acute phase of this pandemic, we need to have access to vaccines in all countries, reaching healthcare workers, because without healthcare workers, you don't have healthcare. And this is extremely important. And also to prevent people from dying. We know now, we've known from some time that some people are at higher risk of dying if they acquire this new coronavirus. And we are talking of people over 65, and also people who have comorbidities, which means have associated diseases. So it's really, really important that countries think about this, and individuals think about this as well. What is the best situation for the world? The best situation for the world right now is to prevent deaths among people who are at higher risk of dying, and to protect health systems so that all countries can deal with this pandemic. Another issue that's very important to raise, that when we're talking about equitable access to vaccines, we are not only talking about solidarity. Solidarity is good, but we are also talking about country self-interest, because the more community transmission we have around the world, the more are the chances of the emerging variants that could one day create a problem to have effective vaccines. So it's extremely important at this stage that we ensure that all countries across the world have access to the vaccines that are safe and effective and that are in the market right now.
Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.